Good afternoon, everyone. We just went live a few minutes ago with some updates on our under 65 plans for residents in Nassau County. And so we wanted to come on and have Savannah provide the latest news, the latest outcomes and information that we have received as agents here at Nelson and Associates Insurance for Nassau County, to provide the updates on the customers or the individuals that live here in Nassau County that are on a Medicare plan that is serviced by Florida Blue, to discuss the Florida Blue and Baptist relationship. So Savannah, if you can share with everyone what has been brought to you as of today.
Yeah, I was actually just reading a news article, so I think I should come on and clear the air a little bit. So yes, everybody has seen so far. Most people have seen that Florida Blue and Baptist did come to a form of agreement, which ultimately we are thankful for. My groups are thankful for it. It is going to help a ton of people. What does it mean for Florida Blue members who are Medicare Advantage plan members, though? There is a stipulation. Now, there hasn't been an official statement by either side yet. However, there are rumors flying, like everybody's trying to find an answer. So we wanted to come on and give you the latest update, as Kim said, that we have. And that update is that if you are a current Florida Blue Medicare Advantage member, you will no longer be able to see your primary care doctor if they are in the Baptist network. So if you have a PPO, you would be considered out of network. And if you have an HMO, you would not be able to go. And so that is what we are hearing on both sides, both from Baptist Health and from Florida Blue. So that's not just, one person, that is, pretty solid. And with that being said, though, the good news is if you're seeing a specialist or if you need to go to the hospital, you will be considered in network. So there is some good news, some light to this tunnel. But the even better news that we have to offer you is that we have options. We can help you. We can help navigate through this. AEP is 13 days away.
Yes.
And this could not have come at a better time. And I know that sounds like we're making light of maybe of your situation. That's not the case. We're actually trying to bring light to your situation. Yes. That's kind of our job, is to bring light and find hope in all of this. And so I'm very excited to say that in just 13 days, you can make a decision and you can make an informed decision about how you want your health care, how you want your health insurance to look like beginning January 1st of 2025. And ultimately, that's my job. That's my job to help you navigate that, to help assist you on what your options are, on what's best for you, based on a conversation that we have individually. So I just wanted to hop on and share that while it's not 100% great news, your specialists, which are usually the most important in this last quarter, will still be in network. So please feel free to continue to go to your specialist. You should still be in network for those, as well as the hospital. God forbid you have to go to a Baptist Health hospital for any reason at all. They will treat you as an in-network patient.
Yes. So I want to make sure to, I just want to speak very clearly so that there's no added confusion to everything that's been going on. Mm-hmm. So in Nassau County specifically, okay, the residents of Nassau County were only offered one Medicare Advantage plan through Florida Blue this past year. Or how many Advantage plans are available in Nassau County?
Through Florida Blue.
Yes.
Yeah, so there's three total. There's two PPOs, the value PPO, the regional PPO, and then and those are just network. Like then the networks are a little bit different on both of those. And then there's a PPO designed for veterans. So three total.
Right. So and those plans are now no longer in network to receive services from a Baptist primary care facility. So if you go to Baptist primary care, as your normal doctor that sees you on a regular basis or when you're sick, those visits until the end of the year, if you decide to switch your plan, those visits are going to be
out of network. Yeah, the PPOs all have an out of network benefit. So if Baptist is willing to see you as out of network, then you can pay the out of network price. Ask them if you can pay cash. I know some providers may let you, some may not. Ask questions, advocate for yourself, as I've told you guys before.
Yeah, so if you, and please understand, we're not saying you cannot go to your primary care doctor. You can go wherever you want to see whoever you want. Just understand that the Medicare Advantage, Value PPO, and Regional PPO,
Patriot.
and the Patriot PPO. So there's not an Advantage HMO plan for Medicare Advantage in Florida or in Nassau County that is offered by Florida Blue.
Correct.
So those are the only three options now. And again, you can still go. If you get sick, by all means, go to your primary care doctor. Just understand that what you would normally pay as a copayment may be different.
Yeah, and there may be some. I think we should have this conversation individually, because I'm being told this is where things are getting a little confusing, and I don't want to confuse everyone.
Sure.
So I'm hearing that some of the doctors are not seeing you, even if you're out of network.
Wow.
So, with that being said, we don't make those decisions.
Right.
We don't work for those offices. I can't answer to why you're being told that. So call me. We can talk about things individually. We can give you options. Should you want to get established somewhere else, or if you just are sick and want to go to the doctor, I can give you some recommendations on urgent cares.
Yes.
The co-pays for urgent care, just so you're aware, on those Advantage plans, with Florida Blue, they're the same in or out of network, so you can go to any urgent care.
And do you know what that copay is?
They're different per plan.
Okay. So there's care available.
Absolutely.
You're not teetering out here in the ocean for the next 3 months and not able to see your doctor. You can see a doctor. You should see a doctor if you're sick, or if you have a need or an urgent need. You're always free to use the emergency room too if it's an emergency. Utilize those resources. But for primary care now, if you have to go see a cardiologist, or as Robin likes to call the ologist family, doctors, those are in network.
Correct. Those are in network, as well as the Baptist hospital system. So Baptist Nassau, Baptist Downtown, Baptist Beaches, Baptist Clay, so on and so forth. South. I think I almost named them all. So yes, all the Baptists.
Yes.
You can go and be in network. So say you have a surgery planned, or some people have told me they do, and a specialist is doing that, great.
You're good to go.
You're good.
Don't worry.
That's the good news in this. It's like a thanks but no thanks type situation. Some people are okay with it. Some people are still kind of bummed. So with all that being said, though, again, there's a news article that just got released 2 hours ago that Kim hasn't even read yet. That it's only on HMO. That's not true. You're on a Florida Blue Medicare Advantage plan. Your Baptist primary care is no longer in network.
So, and for an additional piece of information, and when we did our first live video, when all of the negotiations were getting down to the wire, and we wanted to kind of provide a peace of mind to our customers and those who may be shopping for a plan, we want you to also understand that, and we can't really get deep in the weeds with this, but there is a difference between a Medicare Advantage plan and a regular Medicare supplement plan. Medicare supplements, if you have plan EFG or whatever they are, you're good to go. Because standard supplement plans, because this is the reason why. If a provider, whether it be a hospital or a physician or a lab or any type of healthcare provider, accepts Medicare assignment, right? Then your Medicare sup plan is in network. There is no network with med sups as long as the provider accepts Medicare assignment. Right. So this all really only focuses on the Florida Blue Medicare Advantage plans with primary care doctors. So it's really a small issue, where it used to be we were bracing for the worst. And so now The only issue is your primary care physician. If you do not know where to begin, or if you have questions at any time, please call our office. Savannah is our director of our Medicare department. She is up to date and gets notifications by the hour of what is going on. And if she does not know the answer, she will work for you and call and just ask for you. You can come into our office. We can help you. But please do not feel that you're out floating alone and no one is trying to resolve an issue or answer a question. You are not alone. That is what we do, and we have chosen this industry and this job to service our customers in Nassau County and surrounding counties. We have customers all over. So, but because this affects us and, here locally, we wanted to come on and just provide another moment of updates and comfort to let you know we're on top of it and we have backup plans. So in addition to all of that, just like with we were able to get Morgan ready to sell other carriers for our under 65, we also now have the ability to offer Medicare products in other carriers that are available here in Nassau County as well. So please know that your options are there. You're not pigeonholed to a specific carrier or a specific provider. That's what we do. We look for you and help you determine what is probably, a better route when you're choosing your plans. So please give us a call. Our office is here, Nelson and Associates Insurance. Our phone number is 904-326-3288, and Savannah's extension is 106. If you have any questions,
good job remembering.
If you have any questions, give us a call. If she doesn't answer, it's probably because yesterday that was our first day of being permitted by law to start advertising and talking about the annual enrollment period, or AEP, as you may hear. Please know that you're going to get a lot of phone calls. You're going to get a lot of mail. You're going to get a lot of stuff, TV commercials. You're going to see and hear a lot. You have an option right here to come into our office and speak face to face with someone who will take time to work through the entire thing with you. Please do not make a decision based off of, something that you may receive and may not know 100%. Even if you choose to go with someone different, please let us help you. Let us walk you through that process. There's a lot of things out there. There's a lot of options. And so we don't want you to be confused. We want to make it very clear to you as to what you are enrolling in, what your coverage is, and the cost. No, there's no hidden fine print here in our office. And so again, we appreciate all of our customers who called us. They contacted, and yesterday Savannah spent all day reaching out to our customers and explaining what we knew at that time. And here we are today, only the second day behind the cutoff, and we are updating you again. So if you have any questions, give us a call, come by and see us. Thank you for your continued business. We look forward to servicing you. And this year, if you get a call from Savannah to make your appointment to come in for your next year elections, answer it. Her calendar is almost full. So make sure you call, and we will be doing extended periods of appointments also beginning October 15th through December 7th. So give us a call. We thank you so much. Please feel free to share, like, comment, call, ask questions, whatever. But we thank you so much. Thank you for tuning in, and we look forward to continuously serving you.